Kia ora. My name is Dr. Shiver. I'm going to be performing your ENT today, or your ear, nose and throat exam. How are you doing? It's good, it's good. Have you had one of these before? Not for a wee while, okay. Well, while we're here, why don't we update all your personal records and health records? Perfect, okay. Okay, so your name. Okay. Excellent. What was your address? Contact phone. Okay. Yep. And your date of birth. Okay, cool. So, just a couple of questions before we begin. How's your overall general health? Okay. Okay. And that's that? What brought you in today? Okay. Perfect. Okay. Perfect. Do you smoke? Cool. Do you drink? How many times on average? Okay. Yeah. Yeah, okay. Completely reasonable. What is your exercise like? So how are you moving your body? Okay. Yeah, just with working from home a lot lately, it is getting harder and harder to people to find the motivation to move around. And we just recommend that you try and move your body around for 30 minutes a day. We call it 30 minutes a day push play. So push play on your exercise, move around, and then get back to what you're doing. Yeah, perfect. Do you have any allergies? Okay. Perfect. Any family medical history that I need to know about? Okay. Recent operations? Yep. Any surgeries? Okay. And okay. And any recent injuries? Okay. So, onto the questions regarding the exam we're going to do today. Do you have any respiratory diseases that I need to know about? Yes, this can be things like asthma, cystic fibrosis, bronchitis, anything like that. Okay. Yep. Okay. Okay, and any issues with the ears? So, any hearing loss, ringing, partial hear loss, so one ear is fine, one is not fine, anything like that. Okay. Yep. Okay. Perfect. Excellent. We're going to begin by assessing the throat. The throat will also include things like the respiratory system. So I will be having a look inside your mouth and at the tonsils and the back of the throat and the glands to see if there's anything going on there. Also be assessing the glands around here, giving them a good feel, see if there's anything like swelling or tenderness that I need to know about. Then I want to check your lungs using the stethoscope, having a listen to your heart or anything like that. Following that, we're going to move on to the nose. So I will be taking a look at the nose with otoscope, how everything looks up there, make sure that everything looks fine. Then we'll move on to the ears, and I will do just a couple of hearing tests and assess the ears with the otoscope as well. Then do a wee write up after we've done everything, okay? anything that concerns you at all that you would rather skip out on today? I know that some people experience a little bit of medical trauma with certain things that they might want to leave out, so is there anything you'd rather not do today? Perfect. So, could I have your consent to do the following that I just described? The consent can be withdrawn at any time if you feel uncomfortable or distressed about anything, so let me know and we will cut it right out, okay? Perfect. Cool. So, okay, so just gonna put this over here. I'm gonna start with feeling the glands. So, just gonna do a touch around here. Everything seems to feel just fine. Don't really have any swelling. I just want to bring my attention to one side. Everything feels pretty good. Don't really feel any particular hardness or swelling. Are you feeling fine? It's not like any tenderness there. Perfect. And then on the other side. Perfect. Okay. Feels fine to me. Yep. No pain. Perfect. So, I'm just going to take my light here. I'm going to use this little stick to pull your tongue down. So if you could just open your mouth. Pop your tongue out and say a big ah. Okay. Hopefully the light's not too bright. I'll try not to shine it into your eyes. Okay. Say ah one more time. So I'm just having a wee peek at your tonsils, which all seem to be fine. Just looking further down. Teeth look good too. Tongue looks pretty good as well. Changes in pigmentation there at all. Do you need a break? Okay. So just move your mouth around a little bit. Okay. Once more. So open the mouth and say ah. Okay. And I just want you to let out one ah for me. Ah. Okay, everything's moving the way it should do. Can you just engage the throat as if you're about to... Yeah, cool. Perfect. Yes, that looks good. Everything looks fine there. So I'm just going to have a listen to your breathing now. So I'm just going to lift your shirt up if that's okay. So just put this under here. Okay, it shouldn't be too cold. Yeah, that's all good. Okay. I'm going to get you to take a deep breath in. So one in. Hold it. And exhale. Very, very good. Up here. One more. Hold it. And exhale. And one more. Breathe in. Hold it. And exhale. Very good. Now breathe normally. So just nice deep, steady breaths. In through the nose. Out through the nose. Like you regularly would. Okay. Okay. You can breathe back to normal now. I'm just gonna take up some notes. And throat. What good. moving and functioning just fine. The lungs sound pretty good. When was the last time you had your blood pressure measured? We can do that today if you like. There's no problem. Cool, we can do that. No problem whatsoever. Keep you nice and up to date. Perfect. Okay, so just your blood pressure monitor. If you could just roll up your sleeve for me. Just wrap this around your arm. Very good. And then pop these on. Very nice. And okay, so just place this on. Excellent, that looks pretty good. Just undo this. Perfect. That looks good. Nothing to worry about in that department. So, blood pressure. All good. Okay. We're going to move on to the nose and the ears. Got this otoscope here. So I have a set of guards basically. That way we can use the same otoscope for the nose and the ears. Just use the guard to shine the light through. For this part I will be putting gloves on. How are you feeling? Yeah, it's not too scary, is it? Being very brave. Okay. I am going to put this inside your nose, that way I can shine the light through it, and then peek through the little magnifier to see what's going on inside your nose, okay? Perfect, so we'll do this nostril first. So just gonna put this in here, shine the light on, and then have a look at what's going on. Okay, so things are looking pretty good up there, no sign of inflammation or mucus build-up. Everything looks pretty good. That seems fine to me. Okay. Use this on the other nostril. So again, going up in here. There we go. Look. Okay, so same here. No sense of information. Nothing too much of concern. Things seem to be looking pretty clean. Not too much mucus. Okay, perfect. Excellent. Everything on that front seems to be fine. Now I'm going to do the ears, so I'm going to do this ear first. Have a wee look inside there and see if everything's okay. Once I've had a wee look, I will run a little hearing test for you. Then we'll make up some notes and then finish up, okay? Perfect. So just get nice and close here. So popping this into the ear like so, and then into here. Okay, so things seem to be looking pretty good. Nothing too concerning. Okay, so that's the outside of the ear. Okay. Yep, that looks good. Okay. Looks good. No real signs of inflammation or anything like that. Everything looks pretty good. Okay. Yeah, that's good. And last one, so this side as well. Good. Okay. Everything seems to be fine. Nothing too concerning or anything like that. Okay. No signs of inflammation, wax build up, everything looks pretty good. Okay. Alright, that seems to be fine as well. Just dispose of that. I want to have a wee feel of your ears if that's okay. So just having a wee feel of the outside, maybe pulling or tugging on certain areas to see if there's any discomfort at all. So do let me know if you feel any pain. Is that okay with you? Perfect. So we'll start on this ear. How's that feeling? Okay, so yeah, alright, and around here, how does that feel? Perfect. And when I pull here, how does that feel? This one? I place my finger here, how does that feel? It's all good. Okay, and then the other ear, so okay, just touching here. Okay. How does that feel when I touch here? Is that okay? Perfect. And when I pull here, how does that feel? It's fine. There doesn't seem to be any hardness anywhere. Everything seems to be perfect. Right. Okay. I'm just going to run my finger. Is that all good? Does it feel fine? Yep. Okay. What about here? Seems to be good. If I run my finger here, how does that feel? Excellent. Perfect. I'll just do the same on the other side as well. So if I run my finger along here, how does that feel? Okay. Does this feel okay as well? Okay. Okay, that seems to be fine. Everything looks good. So, just going to make some notes. So the nose. Just find information like that. Okay, and the ears. Okay. I just want to do a little sound perception test. I've got a little clickety cube here. If you could just close your eyes for me. Close your eyes, close your eyes, close your eyes, close your eyes, close your eyes. Okay. I'm gonna click the cube and I want you to tell me where the cube is. Okay? It's very easy. Excellent. So. Okay. Perfect. Perfect. Excellent. Perfect. Good. 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 I'm gonna change to a higher frequency now, so one that sounds like this. Cool. So. Perfect. Excellent. Very good. Yep. Perfect. Yep. Very good. You can open your eyes now. Okay, I'm gonna come a little closer to you. I'm gonna whisper a couple of numbers into your ears. You tell me what numbers you hear, okay? You repeat them back to me. Perfect. So, 1, 7, 9, 8. 27, 4, 3. Excellent. 12, 1, 5. 3, 7, 2. 6, 9, 4, 8. 13. Yep. 12, 18, 3, 5. 1,864. Yeah, it's a trick one. Good job. Alright, so everything looks pretty good. There's nothing to be concerned about at all. Everything seems to be functioning pretty well. You did a really, really good job. Yeah, can be a lot of sitting and paying attention and things like that. So good for you. You did a good job. Well, you enjoy the rest of your day. It was wonderful to meet you. Ka kite, my friend. Goodbye.